All right, so after you work on hip flexion, you need to work on innominate flexion. So in order to test innominate flexion, we'll go back to our Hissel test. If you don't know what that is, hopefully there's a video on the Hissel test. But we'll go through and we want to feel, let's say the hip gets to that 110-degree range. We want to feel, does the innominate flex, right? So let's say that it doesn't. So in order to improve innominate flexion, I'm going to hook on basically creating a flexion moment at my DIP joints to get onto the PSIS in the back. So I'm going to hook onto the superior medial portion of that PSIS. I'm going to take the hip up until it feels like the innominate wants to start moving. I'm going to pull inferior. If you're unsure, pull inferior lateral. Otherwise, you can kind of spring test inferior lateral and then change the angle a little bit to feel where it feels like the hardest infeel is, okay? So as I bring her up, I get on the superior medial portion, I spring test purely inferior, inferior lateral, even more inferior lateral, inferior relative medial, and that's actually what feels like the hardest infeel. So I'm actually kind of coming down on this angle to get on that hard infeel of her PSIS there. And now I'll localize through the leg. So if I go straight up, that engages the infeel a little bit. If I go out a little bit, that's a little less. If I come across, that's even a little less. So I'm just going to go purely straight on. And now I have her PSIS blocked. I'm taking her hip, encouraging innominate flexion, okay? And then from here, I say, hold here, don't let me move you. That engages the PSIS into my finger in the back. That okay? And let it go. Good. And then I'll just try and work on taking up the slack there and hold there. Don't let me move you. And let it go. And I would continue doing functional mobilizations or muscle energy techniques until I feel like there's a springiness to that PSIS or it's not improving anymore. So this is one option for working on innominate flexion in supine.